So, good afternoon to everyone. Welcome to the second semester of the academic year 2022-2023. This will be our first synchronous session, even though it's online. We have the NCM 110 uh, Nursing Informatics. Actually, this is a two-unit subject for lecture, and we'll have our schedule of 5:30 to 8:30, and our session will consider synchronous or asynchronous session and blended as well. We can do online and we will conduct it through face-to-face classes. Yours truly will be your professor, and we will have our 6-week session for the first cycle of NCM 110 lecture. And the learning outcomes that we are considering for nursing informatics will consider the expected competencies that you will learn as a professional nurse in the use of technology. Nowadays, we have the technology that are being maximized in our situation in the healthcare industries, basically as an outcomes also of the situations that we have in the last 2 years of the pandemic. And nurses have been recognized on their skills, knowledge, and even their attitude towards the maximization of resources. That includes the skills, and that includes the use of technology on how we could still consider the healthcare services that we did that will be reached by our beneficiaries from the individuals, families, and communities. As nurses also, we can consider a way on how we will reach the families and the communities. It is not just only on the hospital setting, but also in various organizations such as national government agencies, such as Department of Health, and some of the concerns of nurses that will involve healthcare institutions, specialty hospitals, not just only in the local, national, but also abroad or international setting. Actually, nursing informatics had been in the history for almost 10 years. Even during the time of 2019, 2019 we are already talking about fourth industrial revolution, and during those time we are considering it could lead to to a situation wherein students in the nursing education may not anymore report in school and may still conduct the flexible learning environment using the various platforms. So that is what we are experiencing now in nursing education. The shift, the paradigm shift from the uh, face-to-face classes to its transition to the full online until evolved after 2 years to consider again the face-to-face classes. It is eventually considered as a limitation. It could be a risk, but still we are considering these changes as we embrace the technology as well as part of our lives and as part of our responsibilities as professional nurses. And I think in nursing informatics, we are very much privileged. And I am also privileged as your course facilitator because I know for a fact that you are more advanced. Am I right? In particularly with the technological skills and advancement, you are more oriented, particularly with gadgets that may have high-end applications. And I think one advantage that we may have now in your generation is you explore and you immerse yourselves already in the technology. Hoping in the future this could be a motivation to all of you when you engage yourselves already in research that somehow you can contribute to the technology through a new design of applications that will really help uh, the healthcare industries, or probably it may develop the use of the technology when it comes to provision of solutions to our communities and in varied setting across the lifespan. So this has been our orientation. It may really help the beneficiaries of care across the lifespan. So other consideration is that of our first meeting is focused on the learning objective that will gear towards our discussion on the basic concepts of nursing informatics. Even during those time that I started also my professional practice way back, okay, I will reveal, in 1997, wherein I started to have my professional practice in the hospital. And with my experiences, I can say that at present, it evolved merely on how the nurses will really need to be more updated, to embrace the trends itself as a challenge, and consider on how nurses will now make a realization that it must be an important factor for you to upgrade your skills. And it's very true because the technology itself had been the solution in our situations in the public health emergency in the past 2 years until present. Even though we have loosened the protocols, the health and safety protocols, but still we still consider our priority as professional nurses when it comes to safety. Safety and protection of data, information, and knowledge are very significant so that it will facilitate the effective way and the efficient way on how we manage the healthcare towards safety of our patients. Now, the nursing informatics, I know for a fact that as what I have mentioned, that almost all of you, that the 19 dynamic students that we have now, Centralino Centralino RNs that we have now, are will gear towards evidence-based practice. I know some of you have been exposed to the clinical areas, but I know you're still hunger for learning. And I think those exposure and immersion in the professional practice of our nurses in the use of the technology will gear towards on how you will make a realization that sooner or later you may identify problems, and probably it will consider even in your own hands the solution of using the technology. So let us start with the basic concepts of nursing informatics, because foundation concepts are very important. You have been oriented in the foundations of nursing on the various theories and concepts on how nursing provide a relevant contribution to our society when it comes to healthcare. I know, and we are aware that Florence Nightingale, as the mother of the modern nursing, have considered the environment as the key factors on how we take balance on health of every individual. Even those theories have identified that the use of the various concepts, principles, and theories have contributed on how the healthcare have evolved when it comes to the participation of our nurses in varied setting. Now, with the basic concepts of nursing informatics, we will have an interactive session. So first, the first activity is, again, we will maximize the use of the slido.com. And the first question that are projected now is, what are words or terms that can be associated with nursing? So I know for a fact in the past one year, or should we say 4 semesters, including the summer, you have been aware of how nurses and nursing took part when it comes to your discharge of responsibilities. And this has been recognized even by the government, by the international organizations. So you may just visit the slido.com and with the code 3579619. So we will try to have the projection of terms and words that can be associated in nursing. And in the succeeding activity or interactive session that we may have is eventually we'll consider and connect what healthcare informatic means, what nursing informatic means. So we have one answer for this time. At this time, rather, we have care, we have health, nurturing, nourishing rather patients. First and foremost, when we considered health, so nursing had been part of how we will provide health, optimum health for our patients. It is not just only merely considering the health of the beneficiaries of care, but also the health of those who are providing care. And I think if you can still remember the definition of the World Health Organization, that the health is considered as the optimum balance. It's defined as an optimum balance. So it considered by physical, emotional, mental, and even spiritual wellness. So when we are considering nursing, it always associate health. It associate also in caring. Okay, caring as a core or as considered as one of the core of our responsibilities, because there could be different situations that we manifest caring to our patients. Caring in terms of how we support independence of our patient towards their self-care as well. Caring in support of how the family members can already initiate how to prevent and promote health illness continuum, caring in a community on how health education could facilitate prevention of diseases, and caring could manifest into an organization or institution on how we achieve through the vision and the mission of healthcare institutions towards quality care management to our patients. So merely the caring itself, the care as a core of our responsibility in nursing. I have also seen art. Okay. Actually, we have maximized the use of nursing as an art and nursing as a science. Diba? Nursing as an art and science. Because eventually in nursing, we have considered the concept of science, particularly as a systematic way of how we use this concept when it comes to clinical decision making. Uh, Science as a way of how we solve healthcare issues and problems. Science we use particularly on how we do the use of the nursing process, eventually from assessment to evaluation. That is a way of the use of science when it comes to the formulation of the nursing care plan. It is also considered as an art, and it is a way on how we maximize to be more creative and be more talented on how we will be more efficient in the use of our resources so that our patients will appreciate that the care management at the same time the art itself of rapport. Okay, the art itself of rapport is one value that we considered so that we could have trustworthiness and at the same time cooperation of our patients. So nursing as an art and a science, and eventually caring could be considered also as an art and a
Ma,
science
ma.
because eventually this will consider as well on how we will
Anong oras?
facilitate we will facilitate eventually on the perspective by which we have already for a while we have already considered the point of how we will facilitate yung acquisition of the skills, knowledge, and attitude. So I think I have also seen terms related to holistic. Very good. Okay. If we consider a holistic approach, it is a way of how we will connect now the health, how we will connect now caring. Okay. So in nursing, if we consider holistic, it is on how the nurse will maximize his or her competencies, not just only focus on the problem itself, but definitely on the prevention of illnesses, yung tinatawag nating stress. So these are forms of disequilibrium. We will try to consider also prevention. If, for example, the problem of the patient is on the physical health, but this may also connect or may have an implication to really affect problems with emotions, problems with mental health. So I think if a nurse will consider a holistic approach, then this will facilitate effective and efficient way of nursing care management. So these are the terms that we have identified in nursing. I'm seeing also flexibility. Okay, now in situations why as nursing students you will be exposed into private healthcare institutions, to communities, and to private healthcare institution, it's for all of you to appreciate that there are some situations that we encounter scarcity of resources. In some private healthcare institutions we may have advancement in technology. In public healthcare institutions, we may encounter scarcity of resources. In communities, we may encounter concerns with the availability of facilities. So I think as nurses, we may take into consideration as well that this scarcity of resources may not be considered as well as barriers, but as well as a motivation for our nurses to be more resourceful. And I know you will agree with me. So in the situations wherein it will identify nurses' roles. So I think each one of us will have the realization that we always provide, or we will be focus driven when it comes to the provision of solutions. So I think in the provision of solutions, I know each one of us may consider advocacy because I have seen there a term related to advocates. Okay, if you consider yourself yourselves rather during the time of the COVID-19, I know for a fact that even you lack uh, sources of information, as future healthcare professionals, I know that you may have already the foundations and the basic knowledge about health. So I think you have already contributed with your own families, and I think with your own advocacies, the advocacy that prevention of spread and mitigation of the infection among your families could be an advocacy as well. So I know for a fact that during the time that some of your family members have been affected with the COVID-19 infection, you have manifested caring as well. Caring because you are concerned with those who are non-infected with the family members. You are concerned on how the infected person or family members can achieve or will achieve the optimum health or full recovery. So that comes in caring. And when it comes to the advocacy, I know that you may have promotive and preventive healthcare. So that's why when there are some situations that some of the patients have their home care management for the quarantine, you took already part. You have already manifested caring there. You have manifested dynamism when it comes of how you maximize your knowledge, your skills, and even your attitude. That even though this confidence brought you to the perspective of protecting your own family members, and that comes in with empathy. Because if during the time that you are not infected, you are not even infected with the COVID-19, and some of the members of the communities are infected, you have this empathy of how you will contribute for the prevention of illnesses. And I think the data that really provided you through the use of the technology really help you. Yeah, that's why if you can still remember the time that we are implementing the lockdown, because eventually communities with increased now in continuously increasing number of cases have been considered for lockdown simply to mitigate the spread of infection, because as well during those time we don't still have the full implementation of vaccination rollout. So I think these terms that we have considered here, health, resilience as well, it is on how we cope with the situation, and we have a realization on how we will still continue to use this information, basic information for the mitigation of the infection, not just only for the mitigation of an infection, but for the purpose of having these informations be useful and be meaningful. Kasi pag sinabi natin useful and meaningful, it may create an impact. We've considered also adaptability, because I think this term is very relevant in terms of situations like even in the nursing education during the transition of the full online. I know you have been reactive, but you have embraced these changes and challenges, and it turned out into productivity. So that with what adaptability means. So even the use of the technology, even with the realization if you can still achieve the goals, it is a two-way process. This could be a collective efforts among us in the academe as your course facilitators, as learning facilitators, but you have also helped yourselves on how you cope with the situation. Other than that, and considered also optimism. Okay, optimism in such a way that in nursing, we always consider that we will achieve our goals when it comes to situation that we encounter any issues or concerns with health. So these are now the concerns or the concepts that have been associated with nursing, and I'm really glad that majority of you have participated. Let us now proceed to the next slide. The next slide is related to what are the words and terms naman that can be associated with informatics. Okay? So any terms or words that pop into your mind that are related to informatics. Now, those terms that could be projected here in our interactive session, we will now connect with those terms that have been reflected or projected in the nursing. Because I know informatics as well can be used as well in any discipline. And nursing, I know that you have gathered those terms and words that had been associated in nursing based from what you have read, based from what you have learned in the learning sessions that we have and in the College of Nursing, and those words and terms that probably gathered from the search engines. Now, it is now highlighted in our interactive sessions that informatics are more on the technology. Later on, we will still have interactive sessions. I am encouraging everyone to participate, to share experiences, to raise questions, because these are the key on how we will boost more interest in the topic. So we have data, we have technology, analytical science, transformation. Okay, let's start first with the word or terms that associate with informatics and technology. So even from the start of our discussion, we have already used technology. And as we define technology, uh, this pertains on how information is being processed. I know for a fact that now the technology is being maximized to process information. So you can now send information using your mobile phone. You can send information already using your digital watches. You process already information through the use of the email. You process also information through the use of your laptop, through the use of your desktops. So internet connectivity matters on this process. Computers have evolved as well when it comes to the features on how it will efficiently process information. So the technology itself is now part of our lives, and eventually this has been also a principle that has been adopted in the healthcare industry, simply because this will really consider, even in the past 2 years, that the technology is very important to reach our patients. So before, we have been oriented that the we will become more effective in our care management if we will do interactive or interaction with our patients, because we have been oriented with that, di ba? Even in the hospitals, the most efficient way of managing healthcare of our patient is eventually on the interactive sessions, or rather interaction to our patients, because you can manage to eventually observe manifestations, observe reactions. So if we will try to compare this in nursing education, the limitations, there are always limitations. I may not see you now, your reactions, your gestures, and assess even learning at this time while we are doing our session. So that's eventually the limitation. So that's why the challenge is, the more that we conduct interactive session, the more that I know that you are participating in our learning activities. So with the patients and with the nurses, uh, communication, you have considered communication. This is always part on how we transmit information. Okay, so it's a two-way process. A nurse to a patient to a nurse to the healthcare team, a nurse to nurse administrators and to superiors. So a nurse from the hospital to the healthcare facilities such as health center, and health center to city health office. So the dynamism of the use of the technology when it comes to informatics is very relevant, because, for example, there is some information that could be retrieved in a real-time situation. So that's why this has been maximized during the time of the start of the pandemic, because it will give us the idea if when it's the time that situation will declare public health emergency situation, that it will declare pandemic. That's why even the World Health Organization maximizes the technology so that to retrieve reports on a real time basis. So that's why, since during the time of the 2020, even I still remember March 2020, our government already declared public health emergency, because consistently in major areas of the national capital region and other regions, there are continuous increase of reports of infection. So seemingly it may need to declare public health emergency, so that to support funding, to support initiatives that will prioritize mitigation of spread of infection. So the technology itself had been maximized so that to support. If you can still remember, the Department of Health are using the 4 o'clock habit that every 4 o'clock of the day they will have the updated report of the number of cases, the number of deaths, the number of infected individuals, and the affected communities. That's why it translates into the situation of how to use the ECQ, MCQ, MECQ. So those are the times wherein it can identify areas that will be dependent on the number of cases until it evolved into the alert level system of level 1, level 2, level 3, and level 4. And it has an implication on the use of the technology and the implication of having a real time data and information that we can gather because for the certain situations, let's face it, the geographical areas that we may have may cause the limitation when it comes to technology, internet connectivity, the availability of resources such as gadgets, high-end computers. This may cause the limitations in some of the areas. But still, our Department of Health and other healthcare sectors of our government have adopted the situation that we need to strengthen, we need to increase the bandwidth of our connectivity simply because we need to have a real time data and information. And what could be the purpose? The purpose is for our beneficiaries of care, our public, will definitely benefit from those information for purposes of prevention. That's why during the time when we are campaigning for the vaccination rollout, it is very important for the municipality to monitor eventually the vaccination turnout simply because this may have an implication of why those localities and municipalities have high cases of COVID-19 because it has an implication with the number of cases eventually of the vaccination rollout. So in the situations we're in, we considered innovation. Ayan. If we use innovation in informatics, these are the more efficient way that we think out of the box. We think of situations that how we will become more efficient. Example, if you can still remember the time that we have the contact tracing. Ayan, 'di ba it started the contact tracing when the Department of Health uh, requested or rather call for the hiring of call for the hiring of the nurses who can participate eventually in the okay eventually on the and particularly on the home visit or those areas that have been identified with new variants of COVID-19. So they became responsible when it comes to the home visit. But the problem is that it's very risky during those time of scarcity of PPEs or personal protective equipment. Of there is also that there is no clear guidelines to provide them with hazard pay. So those situations are those risks by which it evolved on the use and maximization of the concepts of what could be the innovative way of using the technology. That's why it evolved applications of the contact tracing app. The contact tracing app could set a standard of a real time data and information that will be cascaded to the local government units and eventually identify those areas that had been reported with the number of cases and eventually will do some mitigation measures to prevent the spread of infection, which is very relevant and very important, significant eventually in how you will protect your constituents. That's why nurses have a major role when it comes to the technology. Now, let us now connect those terms and words that have been identified in nursing and now with informatics. When it comes to nursing, we have identified, I think the most highlighted there is all about caring, holistic. Okay? With the mindset that we have as nurses, our objective is to have care for individuals, to render care for individuals, to achieve optimum health, to achieve balance when it comes to the physiologic situation of an individual. So what could be the mindset? The caring is considered as a value. If we have the compassionate and nurturing attitude, we think always of what will benefit the public, of what will benefit individuals and families, even communities. So if we are considering that we manifest caring to individuals, families, and communities, we will find ways to become more efficient, to become more resourceful. Sabi nga, prevention is better than cure. That is all. That is very true. On the perspective that the nurse who will always set the mind for caring, for empathy, for compassionate, or to having compassionate and nurturing attitude, I think this will create an environment on a healthy community. Now, since nurses have been involved in the processing of information, because data is very important on how you will consider prioritization. So that's why here comes the technology. The technology could lead to an advantage by which informatics can be used. Remember, when the time of restrictions by the IATF had been implemented, most of the patients may be are restricted or were restricted to visit clinics, to visit centers, simply because of the situations that it could be at risk of the spread of the COVID-19 infection. I think during those time, if you could still remember, the most vulnerable, the elders, are the ones that are definitely prevented to visit these healthcare facilities. But I think since they are most vulnerable, so they deserve most of the prioritization when it comes to healthcare attention and consultations. So those situations were challenges, but embrace the situation of innovation through the use of telemedicine, teleconsultation, e-prescription. So the patients may not anymore physically will visit the consultation clinics, but rather it maximizes the use of the platforms to facilitate the reach eventually of health education, uh, treatment regimen, uh, pharmacological management, and even through the use of these platforms, the patient can access the digital or the e-prescription, and this had been accepted by the various pharmaceutical establishments. So I think this really helped on the perspective that it's a win-win solution. The patient can still manage their own health even on a digital way of managing it. It was a win-win solution because the patient had not been had not been exposed to a risk for to contract the infection. So these are the things that really had been considered as an outcome on how nurses have maximized the concept of nursing, and how the informatics had been very useful and very meaningful during the time of COVID-19. So again, this I think could be a very useful interactive session for us to make a realization that we, as future professionals, have considered on the contribution already on the use of the technology and on the use of the concepts of nursing. Not just only in the clinical settings such as the hospital, not just only in public health in communities, but in nursing education in our nursing schools as well. So on the perspective on the introduction to health informatics, there are three terms that are associated in the use of the health informatics. Actually, informatics is the science. So we have mentioned that it's a science and an art. And the science itself is a way wherein it could maximize identification of problems, and at the same time at the end is provision of solutions. So the three terms that have been associated in informatics is eventually its core focus is the use of the available resources. And this concerns with data, information, and knowledge. And we will proceed on this definition as well through examples. For example, I may ask our students, our 22 students on board now, on the I will just state a number, and what will pop in your mind. Just put it or post it in our chat box. If I will consider 37, just a number ha, just a number, 37. What popped into your mind? What popped into your mind? Anything that popped into your mind that is associated with 37. You may post it in our chat box. Again, number 37. What popped in your mind? What 37 is? What is the meaning of 37 to you? So, I'm still waiting for the response of everyone. You can post it in the chat box. 37. What popped into your mind? What does it mean? Okay, let's start to, okay, it's an odd number. Okay, continue. Continue to explore. What 37 means to you? It could be age. Okay, good, good. So, continue. It could be number of nurses going abroad. Okay, it could be price. Good. Sige. Let us continue. It could be seconds. Measurement. Continue. Progress, 37. Okay, 37. If someone will mention that it will be my age, I will appreciate. Just kidding. Okay, 37. It's just a number. Okay, number po sa bingo card. Okay, it's an amount. Okay, let's put it more on the specific na. What pop into your mind na 37 that is more associated in our in nursing or in health? Sige, 37. Okay, early middle age, okay? Sige, continue po. Continue. What 37 means to you? Okay. So some of you, ayan. So weeks in pregnancy, temperature, continue, continue. Age of gestation, good. Sige, explore more. So we are now our neurotransmitter are now working. How about the others? When you encounter 37, what pop into your mind? 37. 37. So I think okay, normal, or it could be weight, very good. So with your responses, 37 is considered as a data. Why we have considered as a data? Because it has no specific meaning. Okay? So, when I ask 37, okay, when I ask 37, most of you may have similar responses, but majority of your responses differ from each other. Kasi there's no specific meaning. I may not have any focus. 37, it could be a number. It could be an age. It could be a temperature. It could be an age of gestation. It could be a number. I think there's a response, a number of nurses going abroad. So 37 could be if I'm going to check your responses, most of you answered temperature. It could be age. It could be a measurement. It could be a price. So it could be an odd number. So we are not unified with its meaning. So yun ang data. So another example, uh, if I will if I will consider 18. Okay, just a number ha, 18. What popped into your mind if you encountered 18? Okay? 18. Sige po. What popped into your mind? You may now put in the chat box. What popped into your mind if we're talking about 18? Number. Okay? Any other? Legal age. Okay, go. Continue. Legal age. Okay, continue. What popped into your mind if we are talking about 18? Aside from the legal age, number, continue po. Teenager. Okay, good. Good. Okay, continue po. Participants. Okay, good. 18. Okay, age ni Dean. I appreciated. Baka 18 years in service. Okay, I appreciated. Age ni Dean. Thank you. So, adolescents, debut. Okay, good. So, again, with the number that I presented to you, again, many responses which differ from each other have been identified. So that is what we call data. There's no specific meaning. But if I will, okay ha, if I will consider now sa number 2, information. The information now will consider specific meaning. Okay? If we are considering it, if we consider this as information, because it will give us a direction or a mindset, or we will be more focused of identifying this data different na from information. Okay. 18 years old. I know if I say 18 years old, all of you will have the same answer. Now, type in the chat box, what is 18 years old? Start. Okay, age. Age. Continue to respond. Age. 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 Gusto ko ulit makita yung age ni Dean. Okay, legal age. Okay, age. Okay, now, what is now the difference? What is now the difference when we use data? 18, no specific kasi there's no modifier, di ba? There's no identifier rather. Identifier to specifically classify this term as as clustering it and classifying it. Yeah, when we use now 18 years as age, 18 years old as age. Buti nga nilagyan ko pa ng old eh. Pero pag 18 years, medyo ano pa 'yon, 'di ba? Medyo generic pa or general pa yung term na magamit kasi 18 years could be 18 years, it could be age, 18 years, pwedeng years of service, 18 years pwedeng period of infection era, 18 years could be yun na nga population group. But when I already use 18 years old, so it already identify age. Okay, now let us now consider. Let's go back to 37 ha. Kanina binanggit natin yung 37. Okay, 37. 37 degrees Celsius. 37 degrees Celsius, I already now consider an identifier. I know and I may expect all of you will have a common response. So, temperature. Okay, continue. It's temperature, 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 temperature. Now, consistent. When I mentioned 37 a while ago, you responded just a number, you responded age of gestation, you responded eventually 37 as a temperature, as an age, as middle age, as a measurement, as seconds or time. So now I put an identifier. We have now 37 degrees Celsius. And you are using already you're using already your stored information. So ibig sabihin, your brain is also functioning. So ibig sabihin you connected the 37 and you connected the use of the degree Celsius and you are using it as temperature. So it's very logical kasi pag sinabi natin 37 and you are doing your documentation, ano ba tong 37 na ito? 37 ba ito ml? Pwede di ba? 37 ml siya, that will pertains on a volume. 37 is this degree Celsius or temperature. So since I have used now degree Celsius, it identifies now temperature. Okay, now let's now proceed to knowledge. Okay. Knowledge now, the use of information that will give us a direction, okay? That will give us a direction by which it will be more specific and clear yung perspective natin. Kasi kanina sa information, we have used an identifier. Now, for the knowledge, it will be more meaningful yung information. Example, sa knowledge ngayon, you have mentioned kanina, di ba, 18 years old is an age. Kung dadagdagan ko to na 18 years old is legal age, will it give us more meaningful information na nag-translate into knowledge? Yes. Kasi example, this considered as a knowledge. When you are attending to a patient who is 18 years old in the emergency room and the client will be subject for consent, can you use the information of 18 years old as a legal age? The answer is definitely yes, and I know everyone will agree. So ibig sabihin, the 18 years old can now facilitate and submit herself for consent. So that is now what we call knowledge. Now we are now using it in a situation, in a decision making that will now consider yung appropriateness, protection, safety, legality doon na siya nagtatranslate as a knowledge. Okay, now, i-translate natin kanina yung 37 degrees Celsius. Okay, 37 degrees Celsius as vital signs is a normal temperature. Will it be more meaningful? Yes. Kasi, if for example, 37 degrees Celsius is a temperature and it is normal, then it will focus now on the perspective of prioritization of care to the patient. Because if there are other deviations in the vital signs, since temperature is normal, as a nurse, I will not focus on the management of temperature because it is mainly normal. If we have a problem with other vital signs, then I think that comes in when it comes to priority. So the knowledge itself becomes more meaningful. The knowledge itself becomes more useful on the perspective of a nurse. So dito ngayon umiikot of what we consider data, information, and knowledge. Uh, your acknowledge po, Miss Baron, your attendance is acknowledged. Now, let us set another example because the next session that we will have on our discussion will further discuss about data, information, and knowledge. Okay. Let's have another situation. Okay. Yung let's use other than the number. Okay. Mail. Okay, mail. Kung i-consider mo ang mail, I know every mail. Tingnan nga natin kung anong response ninyo. Pag mail. Okay, mail. Okay? Okay, mail. Gender, person, gender, patient. Okay? Patient. Okay. Now, from your responses, nagiging majority yung response ng gender. Will you consider it now as a data or an information? Will you consider it as a data or information? So, tingnan ko nga kung titingnan natin yung analysis. Okay, information, information. Now, you're connected with me. Kasi it was considered as an information because it already specify a gender. Ngayon, if I use a gender, for example, gender, probably ang maging your response to be could be male, female. Okay, male, female, gender, male, female, female, male. So, and now, ang gender po, meron po tayong ginagamit din more than male and female. So, pag sinabi nating data, gender to kasi there's no specific meaning. It can respond many information that may vary. Kaya eto, typical example, pag kayo ay nagpi-fill out ng form, lahat ng nandoon, fill out the data. Pag sinabing fill out the data, name, o di ba? Kayo yung magsusupplement ng information. Address, magbabari ang sagot nyo. Kayo magsusupplement ng information. Gender, you're aware, you will supplement the information. Kaya lahat ng mga nakalagay sa mga empty forms, these are data. When you fill it out specifically, that will answer on the what is being asked dun sa form na yon, you are supplementing already information. So that's why when we considered po yung sinabi natin na male, we have considered po as a gender which is data, the male is now the information. Question sir ngayon, how we will consider it as a knowledge? Tingnan natin ang knowledge ha. Magiging knowledge na siya that sa research findings. For example, you are reviewing literature. Male patients, male individuals, wag na patients. Male individuals are high risk of heart diseases. So nagkaroon ng meaning, di ba? Because it's based from research findings at based from the literatures that male individuals are high risk of developing heart diseases. Very meaningful. So why it become meaningful and how it becomes useful? Kasi you will focus in a certain population to give emphasis on prevention of diseases, specifically heart diseases, to male population. So I think this had been a very productive discussion, and we will go into details pa when we reach those discussions of data, information, and knowledge. Now, let us now consider the perspective of how health informatics is very relevant. I will have now the video presentation, and this video presentation can be also accessible in our central Linopit staff, the NEO LMS, and the information that will be presented in this video presentation will be very useful in the succeeding parts of our discussion for today. So let's play our video presentation on health informatics for a while. Okay, so thank you very much for watching the the video presentation. And again, this can be accessed in our Neo LMS. So let's have some of the let's have a review of what had transpired in the video presentation about health informatics. Since we have started the concept or discussion pertaining to the nursing informatics. Now we will focus on the general perspective of health informatics because in health informatics, it can cover other disciplines and professions, not just only nurses. And in the health informatics, if you consider the about information, I know for a fact that you are aware of Data Privacy Act, anti wiretapping law. So these are related to processing of information. Kaya if we use the technology, we are processing the information, these are informatics. So just similar on the use of the computer. We use the computer, we have our gadgets, we can store files, we can store photos, we can store messages, we can even store now files that had been downloaded in our gadgets. So the storage itself and retrieval and the access itself is informatics. So that's why before there are some situations, or there are most before, that we can retrieve information through the use of the library. The physical books that we are using are those sources of information if we have the assignments, if we have examinations. But now we have already ebooks, we have already access to EBSCO, we have already access to information from the various sources, web sources, legitimate web sources. So indeed, it really evolved on the use on the processing of information, the access itself, the storage, and as well as the protection. Protection is also very important because this will consider the data subjects to be protected with their information for purposes of confidentiality and privacy. So that's why we have the Data Privacy Act here in the Philippines on how we protect the information. So so that this could not be abused, kasi there are some situations that uh, hindi meron naman tayong freedom of information, but it must set also the limitations for the protection of the data subjects. So that's why when it comes to a point that, for example, you have a sensitive information that may not need to share, or may need to share only to those authorities, such as the health practitioners, your attending physician, your nurses, it will just only limit those informations for purposes of this professional to identify prognosis, diagnosis, and interpret the treatment regimen and promote pharmacological management. So, in these situations po, storage itself, aware tayo, it can be stored into CPU, into the physical computers that we have, and the laptops that we have. So data storage itself, the analysis also could be part of the information processing, because for example, you have been presented with a graph, with the numbers. If it becomes an analysis, then this could become more meaningful or useful with us. So yan po yung tinatawag nating informatics. The storage itself, the analysis itself, and the retrieval, the access and protection are part of the informatics because it used the processing of information using the technology. The second concern is that of how we will now insert health. And the healthcare and the health itself, it involved the principle of how we achieve promotion, prevention, and curative, even rehabilitative phase of healthcare delivery system. Just like, for example, a typical example before, the situation goes that a person or a patient will be requested to proceed into the hospital for the chest x-ray, for the radiographic studies. The patient may need to be in the hospital physically, and eventually will take a long time for waiting on the results, because it may need a doctor, a specialist, uh, that will consider the official reading and impression of your chest x-ray. And upon visit of the doctor, so it may depend pa on the time, then you will definitely rely on the time frame when the doctor will read it and release the official result. If the doctor or the specialist who will read your results and its impression will reveal on a later time, it will also cause a delay of the intervention. And that will consider also a late time of consultation to the doctor, so that to have the prescribed treatment regimen. The time element matters when it comes to the use of informatics and in connection with health. So, this is now the situation in most of the healthcare institutions. In the healthcare institutions, those specialists who may read the results or the plates of x-ray may use a digitalized version of plates. So that's why even the doctors or the radiologists can just basically receive the digital version of the chest x-ray plate, and they could eventually have the initial impression of the reading. Though with these readings, it could be sent through the health information, or rather the hospital information system, direct to the appropriate department, and the appropriate department can already facilitate the results and can release an issue to the patients. For example, compared to a traditional way, the patients may have or may be in the hospital at 8 o'clock. And if the doctor arrive at 11, or if the doctor arrive at 10 o'clock, then that's the time that the patient, or rather the doctor, will do the reading, and it will take time an hour, for example. And at 1 o'clock, the results have been released, and eventually may have a consultation to the referral specialists or doctors. So now, compared to a situation, if we use the health informatics in the way that around 8 o'clock, the patient were subject to chest x-ray, the plate, the digital version or format of the plate could be sent to the radiologist. Then the radiologist may receive it at 8:30. At 8:30 to 9 o'clock, the impression or results can be processed and can be retrieved by the hospital and those who are in authority. And by 9 o'clock, results can be released. By 9 o'clock, the patient can already seek consultation to the doctor and may attend to the prescribed treatment or pharmacological management. So can you imagine? The efficiency is the result or an outcome of health informatics. In just 1 or 1.5 to a maximum of 2 hours, it already managed the demands or the need for the situation that the patient will attend and prioritize his condition. For example, if if the result is highly communicable, such as tuberculosis. So, for example, it's on a degree of a severe level of tuberculosis. So, from 8 o'clock, that the patient has been exposed from the traditional way to other individuals and had been exposed to other individuals at the time of 8 o'clock up to the 2 o'clock, since the results are not yet officially released, the chances that the patient will be exposed to hazards and may have complications to the patient himself or herself, or there could be possibility that the patient already spread the infection to others or individuals who may be contacted with the tubercle bacilli, which is the cause of tuberculosis. So that is now the problem. But if the time frame itself, through the use of health informatics and process already the treatment, the patient can already prioritize first prevention. He or she may already be aware of the diagnosis and may merely consider measures to mitigate and prevent infection. If the patient will already submit herself already with the prescribed treatment such as medications, so I think that it will bring confidence to the patients that he or she will start immediately because of the degree of the tuberculosis as based from the result had been revealed. So it now consider these outcomes as very helpful for the beneficiaries of care and how it facilitated the processing of information to the patient, to doctors, to authorities, and as well as how the hospital will have rendered this information to a more useful and meaningful for prevention also of these complications. So in this situation, this matters when it comes to efficiency on maximizing the resources and effectiveness on how the person will prevent complications. So that's why another situation that we may consider is on the perspective that health informatics are very useful or were useful during the time of the COVID-19 pandemic, wherein the distance is not anymore a barrier because the patient can already have the teleconsultation. Nowadays, we have the what we call telemedicine, wherein the patient can have the consultation remotely with doctors. Nurses can already facilitate monitoring of elders even at homes. Those who are ambulatory patients can already manage on the the intake of their medications, even use of the various applications and platforms, even in their own mobile phones, they could facilitate already their high independence when it comes to the management of their own uh, prescribed medications. So let's put now into the perspective. Nurses can make a difference on these situations, and health informatics now matters on how it will still contribute on the transition and changes that we could consider. Most especially with our situation of the implementation of the Republic Act 11223, which is the Universal Healthcare Law. Now, let us now proceed to the definition of the healthcare informatics by QCEN 2003. The definition of healthcare informatics is on how to use the information and the technology as well. So we have already realized in the situation how the information was processed and how the technology processed the information and how it benefited the healthcare professionals and the patients themselves. So it's a matter of communication. Why communication? The patient received those information, the doctors received the information, the nurses received those information, and what could be the impact of this? This was considered, or these were considered as references to facilitate the patient's awareness on how she will prevent complications, on how the nurse will particularly reiterate and emphasize discharge planning. So other than that, the basic information that could be translated through the use of the information and technology through healthcare informatics will cause mitigation of error. Why? Because, for example, if the patient were subject to a particular diagnostic examination and the results will be revealed by the laboratory scientists or medical technologists, this could be accessed by nurses, by doctors, by specialists. So, indeed, with the access of information, it will consistently interpret correctly by those professionals. These are the problems before. If there are healthcare professionals who may interpret differently diagnostic results, this may facilitate continuous coordination. You need to call the professionals, or you need to call the doctor how this could be interpreted. You need to call the specialist on how this what could be the official interpretation of these diagnostic examinations. Now, it will have an equal opportunity for the healthcare professionals if they could access real time, simultaneously results. So that eventually, again, the time element matters when it comes to this intervention. It will mitigate and will prevent error because they can already access the exact number through the access itself of the documents. Anyway, probably you may ask, sir, will it be risky? Other doctors may also had the access on the results of my diagnostic exams. Remember, we have the viewing rights, meaning those who will be in authority will be given the viewing rights to the results of your diagnostic examination. And that merely still consider healthcare informatics. There must be a protocol that will protect the subjects who are the patients when it comes to the information such as confidentiality. Now, since the healthcare professional, as a collaborative effort, will consider now decision making. Collaboration now matters on how the doctors will provide holistic healthcare or patient care management, because it's now evidence-based and it can be accessed real time by the healthcare professionals. So this will also give information. Okay, let's have a situation. In a typical situation in an emergency room, there's a pediatric patient that were admitted, or that is admitted rather in an emergency room, and the attending physician will come from from Bulacan, and it will take 1 hour if it is NLEX and 2 hours if it will take MacArthur Highway. So the time element itself is very significant when it comes to management of emergency situations. Moreover, with pediatric patients. Now, what will be the role of the nurse? The role of the nurse is definitely to do initial assessment of the patient. And the initial assessment of the patient matters on how the pediatrician or the specialist will respond accordingly on the treatment regimen. Through the use of the technology, if the nurse will just click in a specific platform that is being used by the hospital. These are the symptoms. Click, 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 click. Now, simultaneously, in real time, the doctor has the access on the assessment of the patient, and the rather assessment of patient by the nurses. The doctor may have also a real time while still not physically present in the hospital. There is already an interaction, digital interaction between the patient, rather with the doctor and the nurses on what could be the initial treatment that will be administered to the patient. So since these are the interpretation of the patient, and here comes the clinical decision making. The nurse has a major well has a major role on the prevention, because she's the one who's having the real time and actual interaction to the patient, and the doctors could help when it comes to guiding the nurses and the other healthcare practitioners who are attending to the patient. So on that matter, if we are using the technology and it matters already the results, now uh, the nurse can decide, doc, since I have assessed that the patient is having the chest pain, the patient will be subject for the ECG. So the doctor will just click, okay, offer a diagnostic have an order of the ECG. Then the nurse will continuously and simultaneously do the ECG to the patient, and with the results, initial results, the patient, or rather the nurse, can already send the the initial results or the access of the ECG. There are some platforms pa nga, mga platforms in the hospital that once the patient is having the ECG, nakikita na agad ng doctor yung mismong wave of the cardiac rhythm. So that's why the doctors, even on travel going to the hospital, are now aware of the interventions. So the patient, rather the doctor will order, or nurse, please administer na this drug that will help the management for cardiac rhythm. So eventually, with the time frame, it's now ongoing po yung in exchange of information, and at the same time it supports the real time decision making, and it definitely gives an essence on how we manage emergency situations, because we will not anymore wait, unlike before, di ba? We'll need to wait for the doctor, because she's the one who will attend. She will be the one who will give the orders. I cannot fulfill my role with anything that I will do to the patient will be dependent on the doctor's order. So it's now not anymore in that situation. Through the use of the health informatics, we can now consider po the means on how we will facilitate specifically the efficient way of managing our patients in the emergency room. So these are the typical examples by which health information or health informatics are being administered. Next, if we're considering health informatics, we are considering also revolutionizing. Okay, if we say revolutionizing, we are aware even in the history about industrial revolution. I know I have mentioned this a while ago about fourth industrial revolution. How can you imagine that patients can do consultation through online? How the nursing students can do the return demonstration in a digital and video recorded return demonstrations. Even before, we have not thought that this will happen. But I think the perspective of use of the technology have revolutionized. Kasi ibig sabihin revolutionized, it already evolved. It has the paradigm shift. It considered already the transition that we need really to embrace now, the perspective of health informatics that will be part already of our role as healthcare professionals. We have mentioned about caring as our core responsibility, as the value that we consider. And if we have the mindset of this value, we're always consider po that the mindset of any good, or anything that will contribute to the recovery of the patient. That's what caring is. And we always manifest this for the patients to experience recovery and achieve the optimum health. And the purpose is to improve health of the entire population. So it is not just only that the evolution, the transition, the changes on the use of the technology will focus on individuals, but we focus also on the entire population. We focus also even in our profession. That's why we value the perspective of utilizing the research findings. Okay, the research findings itself is very important. And I'm challenging the second year, ha? Second year, I'm challenging all of you na when you reach third year and you will have your research, you may explore na yung magiging research ninyo will focus at the end a particular application or technological advancement that will really help our healthcare industry, that will benefit our patients, that will help definitely or will benefit our profession. So I think that is more on the utilization of the findings of your research. Today, as of today, I'm challenging everyone here to think of those advancement that you can contribute for the society. It is not just only for compliance of academic requirements, but I think the impact itself, if you will think, okay, I will think of the things na that I can contribute. Example lang, we are aware that how can we identify high-risk pregnancies for the community? Kasi, di ba, the typical way is we do home visit. So, but if we will try to develop or design an application that will identify there all pregnant mothers in the communities and will identify their specific symptoms or identifiers of diagnostic results that will consider them at the end, you are high risk. I think that could be the best contribution that you may have in that community, because once the patient will be identified as high risk, then I think she will be alert, she will be alarmed, and will seek medical attention the soonest. Okay, so on that situation, that will help. Another, if you will develop an application on how we will attend timely response to emergency situations, just like disaster situations. So for example, if there are calamities or disaster situations, if you can manage to create an application on quick response team, it will just click the area and it will register there. It will have a database of those who are certified first aiders or lifesavers. Then, if there are emergency, you will just click who's the nearest, okay? Who's the nearest healthcare professionals or practitioners or certified BLS provider, and that could really help. Kasi you can identify the individuals nearest to you or closest to you who could be an access for you to assist you when it comes to emergency situation. And that could help you now, even though they are not physically present or at your side, you can contact them so that even nearest, while she or he is going to your area, you're already being guided by them. So hoping these are the situations that will really now boost your neurotransmitters as well when it comes to research. So eventually, I will now maximize the time. Supposedly we will have the break for us, 15 minutes break to for us to cut the synchronous session. But I hope with your permission, we will continue na the 15 minutes discussion so that it will facilitate na po that after the discussion, it will proceed na po to the asynchronous session. But anyway, I have not yet indicated the asynchronous activities in our Neo LMS. I will just give you I will just put an announcement in our messenger if those asynchronous sessions or activities are already available. But for the meantime, you can access those resources already in your Neo LMS. So let us continue. Okay? So now, in the perspective of the health informatics, there are 4 principles on the use of the computer in information science. So aware tayo when it comes to the computer. Now we are using a typical use of the CPU, the monitoring or the screen. Now laptops. Now we have tablets. Now we have gadgets that are now portable. All of these gadgets can really store information. So why we consider now computer and information science? Computer science because of the use of this equipment, should we say, that can store, that can access information, that can definitely analyze information. It's definitely the computer. The information science comes in on the perspective and the principle that the information that had been stored has translated into a more useful and meaningful information that will benefit the user. So yun. For example, I stored, for example, in an Excel file, I have indicated there the age of my patients that I assisted within the day. 10 patients, I indicated the age. Now, that's mainly the use of the computer because I have used the applications, I have used the system, have used the computer as technically using the system itself. Now, it becomes an information science if I will now consider this age bracket on identifying it on the base from the growth and development from the infant to the toddler to the school children to the teenage, and the late adults. So if this will process the information of classifying this age accordingly, and if I applied a specific formula to basically classify these ages, then that is information science already. Okay. So now let us now consider health informatics and the use of the computer in information sciences, particularly on these situations. Advancement of life sciences. We have considered the use of advancement as a way that it could be an advantage, it could be an opportunity. Advancement in life sciences because it will gear you towards that uh, it's an advantage because the advancement itself is a way on how you will be you will consider as a higher level that you are more knowledgeable, higher level that you are more equipped, higher level that you are more skilled. Pag sinabi natin advancement in life sciences. But particularly, we're talking about advancement in life sciences if we are considering research. Evidence-based practice, clinical decision making. These are the information that we could consider as very beneficial when it comes to advancement of life sciences. For example, how the other countries, even way back 1990s, projected already that in the year 2020 they need more nurses. That's why it's very uh, rampant now that is spreading in the news that we really consider now opportunities of going abroad because they are in need of nurses and they have projected it way back 1990s. So what could be the reference of these countries? It's the advancement and the use of information science. So that's why they already stored the information in a storage now cloud. Before yung storage can be used na yung USB, ngayon hindi na, cloud na. So in the storage of those information, longitudinally, those information, for example 90s, they are now checking the trend. The trend itself that we are considering is that of for example, there's a decrease in the enrollment of their locals in nursing. So eventually, what is the effect in the future? The effect in the future is that of there will be also decrease in the projected professional nurses that they will produce. Another is that of why it will increase in demand. Yung projection nila of the number of elders that are increasing. Okay, in the number. Increasing in the number of elders may require also increase in the number of nursing workforce. So that's why in the increasing in the succeeding years, as years goes by, nagde-decrease yung nagde-decrease yung production nila of nurses, tumataas yung elders. So ibig sabihin bumababa yung supply, tumataas yung demand. So that's why they have already projected that the need for nurses nowadays are very significant. So but this was already a product and an outcome of advancement of life sciences and use of the information itself. So yeah, they have gathered all this information, and through the use of the computer, it processed the information on analysis. Di ba? We have the statistical data, statistical applications that we can now that it can already analyze the significant interpretations. So through that, it can identify the trend through a graph. For example, the elders are increasing by the years, but the production of the nurses are decreasing. So ibig sabihin, they need to project or specifically identify a program that will definitely consider yung compromise nila sa healthcare system nila, and they need manpower even in the succeeding years. So another advances that we consider is that of during the time of COVID-19 pandemic, we have identified we still do not have an access of information to prevent or to have the mitigation of infection in such a way that during those time we just relied on the basic infection control. But it turned out to an advanced infection control when we considered yung advancement through the use of the information of the basic, for example, infection control measures, the basic concept of chain of infection. So those are the basic information and foundation that leaded to an advanced infection control. So yung mga information before na merong existence na kasi before we have already the vaccines, right? So it is already proven based from studies. And ngayon we will ngayon still on the clinical trials ang mga vaccines ngayon because eventually this must require a longitudinal study to prove that it is safe. So that's why on the clinical trials now, it facilitates the continuous reporting and how we can consider this as safe in the future. That's why we are reporting adverse reactions of the vaccines for every brand simply because this will be very useful in the future if this will be proven safe, though it may identify the effectiveness and efficacy because this matters in the release and distribution in the commercial market. So this is very relevant in health informatics. Next, number two, when it comes to health professions education. We have already discussed and identified the concerns eventually when it comes to the education, the transition from the full online now in the face-to-face classes, return to face-to-face classes. It is also relevant to our nurses who are attending a face-to-face seminar, trainings. Pero because of the restrictions, it considered the advancement when it comes to the use of the information that can be accessed in the digital world. So we have that's why it translated into webinars. It translated into online trainings. So I think this evolution of the health informatics matters now when it comes to continuing professional education. Number three, public health. I know we have identified one of the I think the situations that we have identified in public health is contact tracing. Now we're identifying if the situation goes that the communities when increase of the vaccination rollout, there's a decreased case. So there must be there must be a relationship with that. So in the public health, we use the information science in a way that number of cases in that area and the number of vaccinated individuals by age group yon. So will there be a direct implication or association with that? Yes. Kung nag-increase ang vaccination rollout mo, it is expected that it will decrease the cases. And that happens in the use of our storage of the information and the analysis itself translated into information science. Number four is on the patient care. Sa patient care, nag-benefit ang computer at ang information science in a way that it really now provided an opportunity for our patients to increase their independence. Even I think all of us here have benefited from the health informatics when it comes to patient care, well or sick individuals. Those who may not proceed to the consultation clinics have benefited from the use of the telemedicine, have benefited from teleconsultation, have benefited from e-prescription. So in this situation, the patient care management is now embracing innovations, and at the same time, even for those who have been discharged from the hospital, the continuity of care is through the use of the hospital information system, and the patients benefited from this because of the continuity of care of management if they are being monitored continuously. Supposedly this must be in collaboration with the public health nurses But since the network is not yet structured here in the country, hospitals are providing these extensive services even the patients have been discharged. So this is the product and an outcomes of technology, that the patient have been reminded of the medication regimen, the doctor that the patients have been reminded of the alert when it comes to untoward signs and symptoms. So what could be the measures on how they will be educated when it comes to emergency situations. So I think the patients have already embraced these changes through the use of the health informatics. So another is, I think this will be the last slide. Uh, we have considered multidisciplinary and interactive field or focuses on health information technology. So we have already identified the use of computer. However, when we started the discussion on data, information, and knowledge, you have already used the cognitive abilities. Why? Because your responses in the chat box have used your stored knowledge, your stored information, and that is merely knowledge. So very useful siya because anything that you have learned from here in learning sessions will be stored, and this could serve as a knowledge already when you encounter situations, appropriate use of this information. So the social sciences comes in on the use of the computer and the knowledge if we will now interact with those individuals who will benefit on the healthcare delivery system using technology. Siyempre, ang healthcare team, social sciences, we interact with them. Patients can also benefit from it. So that's why it considered the social sciences. So it considered the computer as the storage and the access and retrieval of data. The cognitive is how you process and interpret information on how it become useful. Three, on how you will maximize the others when it comes to the useful information that will benefit others. So I think I will end up on this last slide. Okay, this will be the last slide as promised. Actually, if you consider the benefits of health informatics, it consider number one, number two, and number three. Improve, enable. If we considered improve, number one, improve patient care at the individual and clinical level. Okay, there are some situations, or most of the situations before, that the patients are dependent on the presence of doctors, of nurses, and healthcare professionals. But nowadays, because of the health informatics, it increases already the independence on a clinical decision making when it comes to the decisions of our patients. Because accessibility is now a trend. Anytime the doctors can be reached through a technology, nurses can be reached through health education, and those who can be accessed for the information, even the search engines that we have that are available can be useful in the retrieval of information, and this will really benefited from the patient care. Improve the health of entire population. This benefited, right? Because even geographically across the regions, we consider the declaration of the pandemic, and it now considered the basis of the IATF to be lenient with the health protocols, because we have the real-time information that have been very useful on their decision to be lenient and to lower down the alert level system. Number three, enable health organization to deliver care more cost effective. Okay, if we're considering cost effective, instead of kasi pag physical presence, it will really consider cost allocation. But if it considers for the use of the health informatics, and this could be accessed through the use of an information system platform, this will really help the organization. What benefited? What organization benefited? Even the Philippine Nurses Association, as a national organization, have benefited from this. How many nurses do we have in the country? How many nurses have been identified as frontliners who attended in this in areas wherein it identified alert level 3 and level 4. Health organizations such as the World Health Organization have benefited from health informatics, by which it declared pandemic, because most of the countries have already reached the maximum level of alert level of number of cases. So I think in the situations wherein it identified the health informatics and its benefits. I will end up in this topic, and we will continue our discussion next time. But first and foremost, the floor will now be open. If there are clarifications, if there are questions, or if there are any experiences that you will share in the class. So I'll stop the sharing and the recording. Thank you very much.